studies assessment of image quality criteria from abdominal CT examinations. Our purpose was to assess the image quality criteria from abdominal CT examinations based in quality control charts and to demonstrate the importance of implementing an image quality control system. Our methods and materials, it was a retrospective study. It was performed in the CT department from a public hospital. Our sample was a random sample of 500 abdominal CT examinations grouped in 20 smaller samples, each of them with 25 exams in each sample. Standard CT protocol from that hospital. The checklist was according to the American College of Radiology guidelines and the European guidelines on quality criteria for computed tomography. We consider the exams analyzed and classified, and this part is very important because we establish stricted criteria, as you can see, as conform if all quality criteria established were present, as non-conform if at least one criteria were missing. So the conformities and the non-conformities found were recorded and used to establish 3 types of control charts for variability. We have the first one, proportion of conformities and non-conformities as P chart. The second one, total number of non-conformities exams, NP chart. And the third one, total number of non-conformities in each sample, C chart. Our aim at the end is to try to suggest corrective actions for improve the non-conformities. In all cases, control limits were established, mean and variance were determined. I'm so sorry, it was a jump in here, but no problem. Okay, our P chart, as you can see, the proportion of P, it was the proportion of conformities and non-conformities. The central line was 48%, and the superior limit 78%, and the inferior limit 18%. In the NP chart, we had the total number of non-conformity exams, 11, almost 12, and the lower and the higher central limits as 29 and 4.4. Now, if I go something wrong in here, the order of the slides is the right one is this one. As the result, the Pareto table of non-conformities group, you can see we have four groups. One, according to the data relating to the examination, the other one, incorrect positioning, and the third one, presence of artifacts in the image, and the fourth, absence of good achievement criteria. You can see in the total, in the first one, the number of the non-conformities of absence of medical radiologist name and the absence of radiographer name. Incorrect positioning, we have 100 and 1, sorry, and presence of artifacts, 67 and 24 as metallic artifacts. Absence of good achievement criteria, absence of topogram, and the absence of the anatomic area under study. As P chart, sorry, now the right one is the C chart, okay. The number of non-conformities, as I said before, in the total sample, this one is for each group of the samples. We can see that we have a central line of 17 and the higher and the lower level, lines, 29 and 473. In conclusion, This research allows the identification of different types of non-conformities found in the abdominal CT image, which have impact on image quality. I think it's very important to salient, to give evidence to the incorrect positioning. It was one of the non-conformities in high number. Therefore, the existence of suitable quality control of the radiography image is essential to achieve high-quality standards in radiology departments. It is recommendable to do training courses regularly, improving radiographers' performance, and strategies to reduce the non-conformities must be implemented. The implementation of a quality control program is required to evaluate the quality of imaging studies performed, determine if the quality is under statistical control, implement corrective actions, perform new evaluations, check if the exams meet the quality criteria. Our references, and thank you for your attention.